illnesses are stressful, but if you've had a heart attack, you are likely to feel frightened and anxious. Coming to terms with a heart attack can take time, and this chapter explores the range of emotions you may feel as you begin your recovery.
Mostly it's shock, utter shock for people that something as enormous as this could have happened to me. And no matter that you might have seen it coming or not seen it coming, it's an enormous shock to the patient and to their family. And people are very, very scared, very scared.
Yeah, but you see, that could be anything.
When people are told they've had a heart attack, they may not openly admit it, but one of the things that's in most people's mind is, this is the sort of thing that might have killed me.
There can be some anger, and that may well be in the early stages, or that may well come on afterwards about why this happened to me, and it's not fair, and they're all quite normal reactions.
I'd just retired and I'd made plans. And so I was feeling quite low in myself at that time because I thought, well, I'd worked all my life and now something was happening and it was going to stop me from getting on with my life and doing the things I wanted to do. I was just thinking, I don't know what I'm going to do now. How am I going to get my life back together, and will I get my life back together, really?
Fears and changing emotions, such as feeling bad-tempered, anxious or depressed, are normal after a heart attack. You might feel frightened that it may happen again, be afraid of dying, or worried that you won't be able to do as much as you could before.
These chest pains can be quite severe, and because you know it's your heart, it's quite a frightening experience.
There's certainly a fear element for some people. Again, not everybody's going to feel that way, but some people just can't do anything. And especially at night when you've got nothing else to think about and there's nothing else to occupy you, a lot of people sort of say that's when they start to think, right, what's going to happen? And they're very, very hypersensitive to everything in the body.
If you're experiencing some of these emotions, it's important to talk about these feelings with your partner or friends. If it's fear for the future, or you think you're anxious or depressed, talk to your GP, who will be able to treat you or refer you for counselling or therapy. Finding out more information about your condition, the treatment you've had, and your recovery can help relieve anxiety about your situation and may help to set your mind at ease. Stress is a word that we hear a lot and usually occurs when we feel unable to cope with high demands placed on us. A little bit of stress is necessary for us to feel motivated and enthusiastic, but too much and it can get on top of you.
We've done surveys asking people a few days after a heart attack, what do you think caused your heart attack? And 80% of people said it was either stress, worry, or too much work. Now, we don't believe that any of these are true, at least not directly. Obviously, if you're stressed and you're too busy at work, so you never eat properly, you don't take any exercise, you smoke to try and keep yourself awake, all those things definitely will contribute to coronary artery disease. But stress on its own, there is no evidence that that can cause heart problems.
So how else do you think stress affects you, Maureen?
I think at the time as well, I was a smoker, which I'm not now. But I think you seem to reach out more for cigarette with anxiety, really.
Yeah. It's a very grey area because things like smoking, you can see, right, I'm smoking 20 cigarettes a day and that means this, and it's very concrete. With stress, it's not as concrete. It's anything emotional doesn't have the same yes or no answers. It does affect you because it can increase other risk factors. So as Maureen will tell you, she doesn't smoke now, but before when she was stressed, she smoked more. And for some people, they'll eat more as well and they'll crave the fatty foods as much as anything else. Stress is not always a bad thing. We all need a certain amount of it. It's just how we actually cope with it.
Everyone is different, and learning to recognise your own symptoms of stress and its causes are the first steps towards managing it effectively.
If you're stressed, there are lots of things you can do about it. For a start off, Almost every bookshop in the country has a relaxation tape. You can obtain them everywhere. Why not spend 20 minutes every day learning to relax? Listen to the tape, getting your adrenaline level right down so that you feel what it's like to be calm. Think about your work. Do you bring on a lot of the problems yourself? Is it you that's causing the stress by saying yes to everybody? If you are, think about it. Next time, say, I'm sorry, I'd love to help you, I've already got too much to do. So, getting the stress down in your life, if that can help you stop smoking, take more exercise, live a more balanced, sensible life, great, get on with it. Do whatever you need to do some stress management.
You're gonna get it, yeah, come on.
Getting the balance right helps us to lead a healthy, active lifestyle and cope with stress in a positive way. For many people, recovering from a heart attack gives them the opportunity to step back and reassess their lives. You have the chance to make positive changes to your lifestyle so you can look forward to a better quality of life in the future.
Now when I look back, I think, well, I needn't have worried so much, really. But you don't think like that at the time, because it's your heart and you've had such a shock.
I see more of my family now than ever before, and because I see the family now, I feel a lot happier, because you realise what you've missed in the past, and now that I'm with my partner more often and I'm with the kids, life has changed completely. It's a lot better.
If I think about it, I'd say it was in a way good that it happened, because something had to give. And because of that heart attack, he's almost as good as new now. And it's taught him a lesson that he needs to, live life differently. So it's been, in a way, very positive.
I'm looking forward. I mean, to tell you very frankly, I'm happy with my new lifestyle. And I don't want to go back to my earlier life, I'm happy.